Good evening. I'm Tanya Abreu, and you are here with us tonight. It's our 37th podcast. I guess I keep linear track because it's so exciting how much I've learned in 37 weeks with a little break here and there, but for the most part, straight through talking with some amazing people about some subjects that have totally changed my life, but also have changed countless of others in our growing circle. Speaking of which, I want to start out by saying if you have not liked Rethink Your Health with a U and an R on Facebook, please do. And please share it on your pages. It's really helpful to us to grow our community and have more and more impact on healing in our lives. And then we also have a YouTube where you can find all of our episodes as we continue to grow there. We're also on regular podcast platforms like Apple and others. And it's just exciting to see week after week people reaching out to me and asking for addresses and phone numbers and going to our therapists and coming back to me or taking products. Or it's just been a real blessing to have this podcast in my life. I want to announce that in less than 2 weeks, we will be going live with a blog. So please watch out for that on our Facebook and our Instagram. The blog will, I promise you, be an amazing experience, not overwinded, but certainly really giving you print ideas and research and life hacks, right? To be healthier and therefore happier. Tonight, I was introduced to this woman through a friend who has used her services and her guidance for years. She's here in Florida, in Cooper City, and everyone asks her where it is. I always just say it's down south, closer to Miami than it is, between Fort Lauderdale and Miami. But she's been in practice at her healing studio, her office, which is called the Four Gates of Oriental Medicine. I love this. I love this. Amy Davenport, welcome, my dear. LinkedIn has become our new key platform. And I'm glad you're here. Not sure how you got here, but tonight is for you. And that's the beautiful thing about health. When we need information, it comes to us. So let me get back to introducing Dr. Claire Fitch, the practitioner at Four Gates Oriental Medicine for over 2 decades. And tonight I am so excited to say namaste, welcome. We are so honored and enthusiastic to learn from you. Maybe you can introduce yourself, your background, and how you got into years and years of Oriental and energy medicine.
Well, thank you very much for having me on the show, and I appreciate being able to present. For many years, actually, I was in the regular Western medicine field. I worked in the laboratory. I was a medical laboratory technologist. I also worked in public health, and I was a midwife assistant for many, many years. And really, I became very discouraged with the way that Western medicine is. I felt that, pretty much they don't really work on healing people. Everything has been reduced to pharmaceuticals, surgery, chemo, radiation. They really don't have good options and for people. So I actually started out, the first thing I learned how to do was energy work. I studied Reiki in its original form, which is called Usui-do. And then that inspired me to work with energy in a different way. And on the suggestion really of a friend of mine, she said, I see you as an acupuncturist. And I'm like, really? Because I didn't think so. But it turned out that was good advice. And there's a wonderful school right here in the Fort Lauderdale area. It's the Atlantic Institute of Oriental Medicine. It's a 4-year program that's presented in trimester format, so it's completed in 3 years. In other words, you don't get the summers off. So I did that, and I actually, not too long after I graduated, because I have multiple degrees before I went to acupuncture school, I decided to go ahead with it. And I started the program, and then really not too long after I finished, I started teaching there. I just retired from teaching 2 years ago, and it's a really good school in the area. They're actually going to be moving it to Pompano. Before I made that decision, I had been working in the field of biology and cancer research, and I have a master's in biology and cellular and molecular biology, and I was working with human ovarian cancer cells, but I decided it was time to get out of the lab and work with people.
Amazing. All right. So I'm going to put you on the spot, and I'm going to ask you. Now, here's the cool thing. I know many of our listeners know that acupuncture has recently, well, not that, like 10 years, has been approved as an analgesic, even in childbirth. You mentioned midwifery.
Yeah.
So, I've seen it in practice. I spent years at McGee Women's Hospital, and we actually had a midwife who practiced instead of the spinal anesthesia, she did spinal acupuncture. Well, in a very brief way, can you explain to us what the science is behind sticking people with needles in various points of their body?
So how much time you got? No.
Do it as quickly as you can, Dr. Fitch.
Well, there's basic things that I try to explain to patients, and really Chinese medicine is over 5,000 years old. That's, the dating of the records that can be found of it. And originally it wasn't done with needles, it was done with pressure, acupressure. And the first needles were actually made out of bone. And well, think of arrows and weapons, same principle. You make a fine point. So the principle is that obviously we are not just flesh and blood. We have an energetic body, and the acupuncture points are located along channels, also called meridians, that run throughout the body. And when you put the acupuncture needle in, you're opening up the flow of qi in that channel. And sometimes, the channel could be weak. So you may be doing stuff with the needle and the points to build up the qi. And so the needles themselves are all sterile, disposable, one-time use. And they're nothing like an injection needle. And being in the lab, I drew blood for many years. So it's like the width of your hair. It's very, very thin. Once they're inserted, they're retained for, 20 to 30 minutes, depending on what you're treating. Now, it's always so interesting because there's a point in the leg that will open up a frozen shoulder. And so you have to say to yourself, okay, so why is there a point in the leg, on the side of the leg, that will open up a frozen shoulder? Okay, so that lets us know that the communication system in the body is really multifaceted. Many people think acupuncture is just working with the nervous system. But anytime you put a needle into somebody, whether it's an injection needle or an acupuncture needle, you actually stimulate a whole body response. So it's the circulatory system responds, the nervous system responds, the endocrine system responds, the hormones respond. There's so many parts of the body that are responsive when you are putting the needle in. So that's why you get a very good effect somewhere else in the body because of this communication.
Now,
So the
I
body is
put this up on.
communicating, and the information is going up to the channel, to
Yeah.
where the problem is.
Excuse me for one moment, but our viewers love pictures.
Right.
And I found this picture before we spoke because I wanted to be intelligent about meridians. Because I know, and I have a good friend who also, like you, is a doctor of acupuncture, and he has one of these statues in his
Yeah.
office. So, can you talk a little bit about this bust and
All
what
right.
it
Well,
is?
what you're seeing here, okay, I don't know if you could see my pointer from my computer, but all the lines represent the meridians. Okay, and then where you see little dots, those are the actual acupuncture points. So you can see they pretty much they go all over the body. You know, you're just seeing this is an upper body picture. The large intestine channel actually ends at the side of the nose there. And
Wow.
then some of this is gallbladder channel and stomach channel and bladder channel and small intestine channel.
Dr. Fitch, how much of this is related to our vascular system and the road and the and nerves, right? Because it
Well,
seems
that's
to.
what I'm saying. When you put, it's been shown that when you put a needle in, okay, it elicits a total body response. It's the cardiovascular system. So, like you're saying, the circulatory system, the nervous system, the endocrine system, and, even the hormone system. Well, I guess you could include that in endocrine, but it's a full body response. Now, a lot of the reason why acupuncture is analgesic, meaning pain relieving, is that one of the things that it does is it stimulates the productions of different chemical substances that are the body's natural painkillers. And these are endorphins, dynorphins, and kephalins. I could say a whole bunch of big words, but endorphin is the one that people are the most familiar with, but just like the body's morphine. And so I also use the acupuncture, since you brought up the midwifery, to do labor induction. Okay.
Oh, wow.
Yes, I just did, really in the last 2 months, I did 3 or 4 of those. Very successfully, I might add. But it can take 24 to 48 hours for, the body to respond. So I try to tell people, a lot of, one woman was like, well, I'm going to be induced this day, so I want to do it the day before. I said, no, you need to come now. Okay? Because it could take 24 to 48 hours and we may have to do it a second time. So it was good because she came on Saturday and then she started, but then she stopped. So she came back again on Monday and we repeated it. And they were supposed to induce her the next day, but what she did was she just didn't go in. She didn't go in for the induction. So that night she went into labor. So then she went in and had the baby, a beautiful girl.
Wow. Yeah. Well, we have a comment again from Amy who said that she had a midwife nurse practitioner for many years. And she's been learning to meditate. We'll talk about Oriental medicine in a moment because I know you embrace all the modalities. She's living in a small town that doesn't have an acupuncturist. Now, I know that there's a model for. I know there are different ways to do acupuncture. I've actually seen some electric current stimulant devices and things like that. Can you talk a little bit about, have you tried telehealth with anyone in areas where there
Well,
aren't
I haven't done telehealth because part of making a Chinese diagnosis is getting a pulse, and you can't do that through the video. Okay, I mean,
why is the pulse important?
well, let me complete this, and then I'll go back and explain that. The other thing is looking at the tongue. Now, you can look at the tongue online, okay, but you can't do the pulse. Now, the pulses are different in Chinese medicine. We're not talking about I'm sitting here counting my pulse, 1, 2, 3, 4. There are 3 positions on each wrist that are representative and linked to the meridian system. So the pulse can tell you what's weak, what's overstimulated, or what's having a problem. And all of the meridians, there's 10 systems that are paired, and then 2 are the front line and the back line of the body. So there's 12 main meridians. So on each position on the wrist, since it's paired, so for example, I'm on my right wrist. So this is the lung and the large intestine. They're paired. Okay. And then the next one is the spleen and the stomach, and they're paired. And then the third position is the kidney and the bladder. So, and then it's different on the left side. So it's important, that's part of how you make the decision about what point you're going to use. And then also I work with herbal formulas, and I also work with homeopathics. Mm-hmm. So, I need that information before I'm going to treat the patient.
Understood. I have to find it here. Let me pull this up. Maybe you can help us out here a little bit. Here is let me see. Oh, this diagram I found, and I thought, this is kind of a nice diagram for you to respond to, because for those of us that don't have access, or perhaps at this point in our finances are having a hard time even, to see another type of therapist. But can you describe what this kind of whole thousands of year approach that so much of Western medicine is also based on, what it is? And I think I know that, perhaps this is not the way you.
No, this is great. This is fine. Okay. So we already talked about acupuncture and acupressure. Okay. Mm-hmm. I think I've explained the basics of that. And then if we go to moxibustion, moxa is an herb. It's Artemisia vulgaris. And it looks like a big cigar. And it does, or you could say spleef, depending on what mindset you're in. But the moxa, the herb itself, has the unique ability, and when it's burned over an acupuncture point, it will nourish, stimulate the point. It's very effective in trauma. Like if you have a bunch of abrasions, or like if you break a rib. You can't cast a rib, but you could use moxibustion on it, and it will help it to heal faster.
Really?
Yes. And it's an amazing plant. They make what they call smokeless moxa, which is basically just a stick of charcoal. So it doesn't have the same effect. Okay. Meditation is really part of, when we're in school, we learn, and I'll jump across your chart there, Tai Chi and Qigong exercises. Okay. So you do that, and then you go from there into a meditation. So, and again, you see the word Qi. So Qi is the life force energy of the body. And so Qigong actually means work the Qi. So you're doing breathing and movement to work the Qi. And Tai Chi has more body movements with it. Qigong is a little bit more stationary. So then Tuina and massage. Thank you, Pam. Tuina is Chinese massage. And it's different than, like Swedish or whatever kind of massages people get. There's different ways that you use the hands and motion. And it actually includes a couple of stretching things that are almost like a chiropractic adjustment. So it's also very effective. Then the herbal medicine, and this to me is a really big topic because herbs, most pharmaceuticals originated from a plant. Okay. People don't remember that. Okay. The first antibiotic, penicillin, is from a mold. Okay. Penicillium. And it was actually found by this is what you call serendipitous. The microbiologist had a culture plate and it grew the mold on there, and he noticed that it inhibited the growth of the bacteria on the culture plate. So that was the first, antibiotic. So other examples, the heart medication, digitalis, digoxin, those come from the foxglove plant, which has been known by the Native Americans for millennia to treat heart conditions. Okay, so a lot of, the medications, even Taxol, one of the cancer therapies, is from the yew tree. Okay, so to me, going to the original herb is you have less side effects. Part of the reason there are so many side effects with Western medications is that what they do is they take the plant or the substance and they extract it, and then they find the one chemical ingredient that does the action that they want, and they synthesize it. So what they've done, though, is taken that out from the other parts of the plant that are there to mediate any potential side effect, which is not to say that herbs don't have side effects too. Okay, but they're all in formulas designed to prevent side effects from happening. Whereas a Western medication is a single compound. Okay, so it's different. And, the herbal medications are, I have them for headaches, for stomach problems, for pain and so forth. So I always like to remind people that the pharmaceuticals, originated with the plants to begin with. And, in some cases, even animals or insects, can be a source. So, think about, how did people take care of themselves, before, Western medicine? Everybody acts like, this is the answer to everything. And, herbs were used for thousands of years, and it's not just Chinese medicine either. Right. One of my favorite books many years ago was Back to Eden by Jethro Kloss.
Oh, yes.
Okay. And I treated myself with so many herbs, and I lived in Colorado, and a lot of the stuff just grew wild, and I could make everything fresh, and, it was great. And it's a wonderful resource. So what I'm saying with that is that, the Western approach is, part of the reason I left the field was that I feel like they try to scare people. If you don't take this medicine, you're going to die. No, that's bullshit. Pardon me. And, it's, you can't approach it that way, and I don't think that's what a doctor's supposed to do, and a lot of times they don't even know about the medications that they are prescribing. And, I'll give you an example. My last, next to the last trimester of school, I dropped inadvertently a cast iron lid onto my little toe. So I almost took the tip of my toe off. So I had to go to the ER. I was going to just steri-strip it until I saw the whole top go off to the side. And then I said, oh no. So they sutured, and then they always put you on an antibiotic. So I go back, to the primary, who was a PA, and to get the sutures out. And she says, oh, you've never been here. You don't have blood work on you. Let's do some blood work. So I'm like, fine. So they do blood work, and it comes back that 2 of my liver enzymes are mildly elevated. So the next thing I know, they're calling me. They want me to have a liver gallbladder scan, which is like a radioactive dye. I'm like, what? So I was still working at the hospital at the time. So I called the pharmacy, and I said, send me the package insert for this particular antibiotic. It clearly stated that it may cause transient elevations of liver enzymes.
Well, of course, this happens all the time, right?
And so I waited a week, and I had somebody draw my blood, and I reran the test, and it's fine.
Mm-hmm.
And so, you know, this is what I mean, where like the reaction to that to me was overkill.
Yeah.
You know, there's so many things. Why don't you wait and repeat it? It wasn't like it was sky high that you had to be worried, you know.
Well, Dr. Claire, what you said in the very beginning, I think set a pace for the whole conversation. And that is contemporary modern medicine treats people. Other modalities, including Oriental medicine, heals people. That's a very different. And,
Yeah.
you know, modern medicine disconnects every different part of the body. So there's a specialist for the endocrine system, a specialist for the liver, you know, a specialist for the kidneys. Nothing works like that. You know,
no, I know. And that
you're
exactly correct. That's
right.
exactly
You have a tree in my yard that's dying, and I love the tree. You call in an arborist, you call in somebody who knows trees. They don't call in a leaf specialist and a bark specialist and a root specialist.
Right.
They're able to say, this is a system, right? You know, it's funny. I thank you very much, Tim, for being on with us tonight and saying that you're a Qigong practitioner. I took a couple of classes and I found it absolutely amazing. And I want to find somebody local to me here in Lake Worth. I don't know if there's any Floridians listening. But back to this whole idea of Qi, because I want us to be useful to people immediately that are on the call tonight. And that is, let's talk about one of the reasons why we're all so stressed. And that is we don't know how to breathe, right? And we also know that stress is behind everything.
Things about Qigong is it, you know, the other thing is yoga gets you into, you know, breath work too.
Mm-hmm.
And, you know, that is very important. You know, how we breathe and how we move, how we use our bodies, you know, with movement. Mm-hmm. And, you know, this is also extremely important. And, you know, even, you know, going back to the, you know, the doctor and the Western approach is that the biggest difference that I see is that they are treating symptoms and diseases. They are not treating people. Okay. I mean, you swap the word healing for treating, but still in all, like if I do acupuncture, I consider it a treatment.
Right.
You know? So, but that's, you know, it's like, well, you have this constellation of symptoms, so then it must be this, you know, and then let's run a bazillion tests. And listen, I was in the lab field, you know, when we started out, the book was about this thick. Okay, now the number of tests are this thick. But here's the question. Are they important pieces of information? You know, and so,
you know, I overheard two doctors talking. You know, my day job is helping kind of reform healthcare right now, but mostly I can say helping hospitals and physicians stay profitable, right?
Right.
But here's the interesting thing, fascinating. So the one doctor was saying to the other, well, and he's no longer practicing. He has a medical service organization helping doctors credential, et cetera. And he said, you know, I didn't ever learn how to diagnose anybody. I just learned how to run all the tests.
Right.
And then after I ran what would usually amount to tens of thousands of dollars in tests, I would get reports back that would show elevated areas. And I would get all the reports back because I was the hospitalist. I'd get the pulmonologist report. And then I'd able to say, oh, well, it looks like most of your problems are cardiovascular. So let me send you to a cardiovascular specialist who then reruns all the tests. The point of this, however, is this doctor was saying no one's paying for all of these tests anymore. So doctors have no idea what to do.
Right.
They now have to listen to hearts and take pulses and talk to nurses and talk about social determinants of health, things that they have no experience with outside the test. And so I am hoping with all of my heart that there is more and more integration between types of healing and traditional Western medicine that relies on technology and blood tests
Right.
more than anything else. And there's certainly amazing need for blood tests and
Right.
technology.
You don't, here's the thing. You don't throw the baby out with the bathwater, as they
Right.
say. Like, if I'm having a heart attack or I have a broken bone, I'm going to the hospital. Okay. I'm not going, to get acupuncture, which doesn't mean that it can't help along the way,
Mm-hmm.
but, it's like the way that Western medicine has become is to just expect people to live on pharmaceuticals for the rest of their lives, which is
Mm-hmm.
ridiculous. I
Mm-hmm.
personally take no pharmaceuticals. Anytime I go to a doctor, they go, so what pharmaceuticals are you on? None.
Mm-hmm.
And
Mm-hmm.
really, like nobody can believe it because, I look at some of my patients, they're on, 6, 8, 10 drugs. That's ridiculous.
Mm-hmm.
And here's
Mm-hmm.
the thing, because one of the classes I taught at the school was pharmacology. There are no studies that say what the effect of taking a bazillion drugs at one time is.
Mm-hmm.
Okay.
Absolutely. We
It's
know how the
absolutely, they
kidneys
have
and
very
livers
few.
have to
They
struggle just
maybe
to
have it with
process. Yeah.
2, maybe 3 drugs, but you can have a
Mhm.
single person on 3 meds for hypertension. Okay, so what they're doing is they're throwing drugs at it. They're not solving the problem. What's the cause of the hypertension? And so have the person, walk a mile every day. There's so many other things you could do before you start putting everybody on all these meds.
Mhm. Yeah, I love
And
what you
it's
just said. I'm
charging
putting
people,
that
right?
up. Throwing drugs at a problem does not treat the root cause of it.
Well, that's
Like
it.
so
The
many
root,
people, including myself, are doctors just want to put all this diabetes medication on me. When I lost 50 pounds, my that was the root cause. But
right,
doctors, know how difficult it is for average people to say, "Oh, I'm just not going to eat. I'm going to lose weight." The Grim Reaper is behind every obese person in a way that they're not behind non-obese people. But yet, all we do is we keep throwing drugs at people with
right,
serious weight conditions. And
right,
these are just realistic things. It goes beyond weight. There's, stress. We have to look at people and say, look, you need mental health help. That your
right,
blood pressure is not going to resolve with these 20 different medications and 50 herbal teas unless you deal with your son who is a criminal living in your home. I mean,
right.
I'm not being crazy. This is just
No. Stress. 80% of illness is due to stress. So, I mean, it's a
right.
very valid point. And, this is what needs to happen more. And, a lot of the reason that people have so much stress is because most of us are disconnected, okay, from our beautiful planet, the
Mm-hmm.
earth. Okay. And, having lost that connection, it's like you're not grounded. And so just to go out, the expression stop and smell the roses, it's not horse pucky, it's actually real.
Right.
And it's like, how many times do you go to the beach but not see the ocean?
Mm-hmm. Or the
Okay.
shells.
Exactly. But so that that's all part of our health. And that's
Mm-hmm.
why I find that the Western medical putting fear into people is creating more stress
Mm-hmm.
for people.
Yeah, and it's every day. Now, I want to share. I've not used you as an acupuncturist. I'm going to make my way down there. I'd love to meet you in person, but I have used it, and I unfortunately don't use it as a wellness tool, which I think I should. But I've used it
Yes.
for acute
Well, it
disease.
is
I
one of
used
the
it
few things that you can use that way.
right,
Okay. Because, you can just tonify the body and the
hmm
systems.
right,
None of us are spectacularly 100% together all the time. So, uh, and one thing that we didn't get to on the chart was cupping. Okay, so cupping is another form of treatment where it pulls blood and chi to the point, and it's very effective. It can be used in different ways. And you had asked about the electrostim. Certain conditions, electrostim is applicable, but like you mentioned, was that before we were on the Bell's palsy?
Well, I was just going to talk about that with our listeners. Okay. There are 2 times that I've used acupuncture for acute conditions. One was for my late stage cancer by an Israeli acupuncturist who detoxified my body so that the blood, was cleaner and less cancer cells. But I'll tell you, it made me feel like I was 10 years younger after about a week of treatments. Now, after that, about 3 years after I had a cancer clearance, when I only had 6 months to a year to live, about 3 years after that, I experienced a very radical Bell's palsy. My friends who are on the line know what that was like for me, because I've always been a public speaker, and I was at the top of my career game speaking at that point, and my entire left side of my face, like a stroke, just drooped. My eyes were closed. My mouth couldn't smile. It was, Quasimodo like horror for me. And I went to the neurologist, and, they were like, well, we're going to put you on steroids, and it will be, super fast. Maybe you'll be able to smile in 6 months. And sometimes it goes for a year. Sometimes I'm like, no, this can't be. And then I had and actually my executive coach at that time, Georgianne Goldblum, I've got to plug her because she's wonderful, said to me, I've got this acupuncturist here in South Florida. You need to see her. And my goodness, her name eludes me, but we have one on now. We can go to her. And I went to her, and I went every single day. It was not cheap, but it was certainly not expensive. And in 2 weeks, I had one week every day, the second week every other day. And in 2 weeks, I had a smile back, and my eye was open and not tearing. In 3 weeks, almost a month, I was totally fine. People would say, your eyes twitching. And I'm like, isn't that beautiful? It's actually functional. And so acupuncture works for that. But here's something else that I learned. She did it on both sides of my face. And so the drooping side lifted, but the side that wasn't drooping was like getting derma fillers. I actually looked like I had Botox.
It's the same technique you use for Bell's palsy is used to do an acupuncture facelift.
Talk about the facelift. I can use one.
Well, I wanted to ask you, when she treated you, did she use electrical stimulation on the needles?
No, she used, what did you call it? Moxie?
Moxa.
Oh my God, that was my favorite thing. She didn't do it. She had an assistant that came in. She was traditional Chinese. She did the acupuncture. The first couple of times it hurt. And she said, that's because the energy's blocked. The energy's blocked. Right. And it hurt. I will tell you, it hurt. But then at about day 4, it melted. I felt like when you lay in the sun and all of a sudden everything goes away that ever hurt you. That's what it felt like. And then the Moxie girl would come in and just hit every point with the most wonderful smelling heat. That's what she used.
Yeah. Well, I've done it. I've done it with electrical stimulation, and you can get it better quicker than even the 3-4 weeks you said.
Mm-hmm. Wow.
Well, because, and it's funny what you said that she did the other side of the face, because when I did student clinic, one of the first patients we got was this girl, and she had Bell's palsy. When it's always unilateral, one side of the face, and it's like a stroke on one side of the face, but that's the only, area. And I thought it was interesting because she said she went to Nova Southeastern, and they told her they didn't know what it was.
What?
And I looked at her, I said, you have Bell's palsy. I said, I can tell you right now. We took a before and after picture from one treatment, and you could see a difference with the electrostim. So with the facelift, it's the same principle. You thread the little needles into where the lines are, or, angle them up, and you put a little bit of electrical stimulation on. And really what's happening is that where the needles are, a little bit of scar tissue will form and fill in the lines.
Oh my gosh. Now, do you do the facelifts?
I haven't done one in a while because I have a cold laser, and I do it with that because it doesn't require needles. So, there's different
And does
ways.
that help things? I'm sorry, it's not, I know we're about wellness, but looking vital makes us all feel better. And you should see the comments coming in. But I want to try. I want to try. But, does it help with things like the marionette lines? Like this part? Yes.
Yeah. Well, it's a whole, some people just do facial acupuncture.
Mm-hmm.
It's a whole specialty, like you said, even though acupuncturists can do that too, like doctors. But it was
I
funny
know it's all about the wellness.
To tell you this other story about Bell's palsy, because so we had a guy come. This was that girl. We had her fixed up in a week with the Bell's palsy, with the electrostim. Okay.
Wow.
But then we had so this guy came in, but he'd had it for like 6 months. Okay, and hadn't done anything, okay, about it. And so it took us, and he was a little bit overweight, and he had what we would call a phlegm damp constitution. So it took a little longer with him. So we were working on the one side of the face. And then we realized that it was going up and the other side of the face was lower. So he came in and we said, well, today we're going to do the other side, so that at least when he was done, his face was the same on both sides. It was really funny, though.
Yeah, I know. And I think that's kind of why she did me. She just wanted some evenness.
Well, because that's what will happen, because you will.
Yeah.
And that's exactly what happened with him. So then when we saw him, we realized that we had to do the other side. But
my goodness.
It was
listen, I can't let this
experience.
Yeah, I can't let this time run on too much because I need to talk about Reiki with you, because you mentioned you started practicing the original Japanese version of it. And now nurses all around the world, but especially in the United States, can get certification. There are many hospitals that are allowing nurses to practice or encouraging nurses to practice. And there are certain, I'm understanding, Medicare codes that can be used in 15-minute increments as almost physical therapy. So this means that Reiki and this type of energy medicine is now really being respected as something that is good for our overall health. So I found this little benefits of Reiki, and I have many friends that are taking courses in it. And I'll tell you, I was blessed to have been in the former Soviet Union, and I speak Russian, and I had the coolest job ever to be a translator for MGM that came to do a documentary of extrasensory things behind the Iron Curtain. And we traveled to the wilds of Siberia. And there were what might be called Reiki practitioners that would blow your mind. So it was kind of like out of Star Trek. You'd lay down and they'd go, oh, your father had lung issues. I mean, it was just crazy what they did with energy. And they didn't call it Reiki. They just called it channeling the body's energies and opening up, opening up the chi. They use those ancient words. I found this little graphic and I'm like, oh my gosh, why am I not getting weekly Reiki sessions? Talk to us about it.
Okay, so let me explain first. Reiki, ki is the word chi in Japanese. Okay, so Rei is a very interesting, the direct translation means the spirit that lingers after death. So it's talking about spirit. Okay, so spirit energy. But the way that it was and I'm going to piss some people off, but the way that it was, brought to the United States was very commercialized.
Mm-hmm.
Okay. And it's really meant to, it's a form of Qigong.
Okay.
But you're doing it to yourself. And it was really designed as a self-healing system. It's one of the best things you can do to de-stress.
Wow.
And so all the benefits you see listed there are really just coming from, working with the Qi or the Qi. Okay, and when I say it's commercialized, it's because, okay, the term Taekwondo, right?
Sure.
So the original form is called Usui, who was the creator of the system, Usui Do. And he uses the word Reiki in a descriptive form, but that became popularized. And it's actually, you work on yourself long before you go and work on other people. And I'm not saying this to discredit anybody, but it's very important if you're doing Reiki that you do it on yourself to keep your energy in the right, in the right frame for going and working on somebody else. Now, the difference between, in China, they call it outgoing Qigong. And there's people who spend their whole day working on their Qi, and then they use the Qi to heal people. And I've seen them do amazing things like you were talking about, the same thing. But the difference is with Reiki or Usui Do is that you're not using your Qi. There's Qi everywhere in the universe. Okay, everything around us is filled with energy. Okay, and so you're really just gathering it and focusing it into the person. Now, in the palm of the hand is a minor chakra point. You see in the picture, those are the 7 basic chakras. There's actually more chakras than that. There are many minor chakras. I recommend Barbara Brennan's book, Hands of Light. She has the best picture in there for all the minor chakras. But it's also an acupuncture point on the heart channel called Lao Gong. And so you're basically funneling the energy through that point into the person. But it's not yours. If it was, I'd be exhausted every time I did it. And that's why these women and practitioners in China, literally, they spend the whole day building up the Qi so they could do it. But wow. This is different. And the reason I'm saying that about Reiki is because it's become a little bit commercialized. And any energetic healing system takes work. You have to work constantly with yourself. And, before you go out, want to work on other people, and even when you work on other people, you always have to go back and make sure you're taking care of your own energy.
Wonderful. It's about self-preservation in that. And I loved your description of gathering energy from all around us and focusing on ourselves,
Yeah,
and positive energy, right? Because we don't want to
right.
gather that negative. For sure. Now, Amy, you're, she is been trying this. Well, we'll look at that. A lot of people, Amy, and I know that you're a professional, and I know that there are nurses. I see a few on. A lot of people are really tired, just like Dr. Claire was, of traditional Western medicine. I have a friend whose husband is in the hospital right now, and if she weren't there, he'd be dead. That's the bottom line. Because
pretty much when you go to the hospital, you need a medical advocate.
You really do.
My mother had cancers and chemo, and I went with her because, for one thing, she wouldn't remember what the doctor said, and then, she wouldn't understand what they were saying to her,
Mm-hmm.
And, it's like it's become so involved. I don't even know what the right word is, or complex, that you need somebody to help you anytime you go.
And plus, if you're sick or if your family doesn't know the medical system, they believe because you're scared, right?
Right, exactly.
Right. And you just, but when I realized during the pandemic that, you couldn't have anybody in your rooms, etc. There was a nurse, many people heard of her in Fort Lauderdale, that refused to go to her own hospital because she didn't want to be alone, and she died at home.
Yeah.
And it's that pandemic is extreme, right? Dying of a virus like that is extreme, but you know and let's take you out of the hospital. Let's talk about an 80-year-old with heart failure, or a 70-year-old with bad wounds due to diabetes, and they're
Right.
home with incompetent home health. They have substandard food, so they aren't even eating enough protein to be healthy. There's not a doctor that's really paying attention to their chronic care. It's the system is truly a mess.
No, I
And
totally agree. And, a lot of people, excuse me, a lot of people go into medicine for the wrong reason. A lot of the, men went into it because it's supposed to be a good way to make a living, but they have no bedside manner, you know, and they're just in it for the money. It's a different approach. And then you have people who, idealistically want to help people, but then you yourself can get totally caught up in the medical system. My youngest daughter is a doctor, and she did a fellowship in integrative medicine, so she got to work
cool.
with Andrew Weil and a couple other people. But I mean, we definitely need an approach which is a combination. Like every office should have a doctor or a PA or a nurse practitioner, an acupuncturist, a massage therapist, a physical therapist, a chiropractor,
Nutritionist.
and a mental health counselor. So then you're really getting care rather, from a single place, rather than, okay, so now I tell you this, you go here, and then they tell you this, you go there. And it
And then
needs.
half the time you just don't go because it's just too much.
Well, frankly, I only go to the doctor if I need to. I go to my acupuncturist, because I started in 2013. I just had a series of things happen to me where suddenly my blood pressure went up, and I've always been a 90/60 kind of person. And so I tried doing it myself, but that's the case where sometimes you need to go somewhere else. So I went to my acupuncturist, and it took us 6 months of me needling myself and him, mixing up the herbs. And then, it's finally got normal.
Yeah.
But,
Amy
I wouldn't want, if I had taken my constellations of symptoms at that time and gone to a regular doctor, they would have told me I had heart problems, and they would have started putting me on all kinds of crap.
Right.
Here's
Right.
the thing about pharmaceuticals also,
No,
which
for
is that
sure.
every one of us is genetically different in our liver. Okay, the liver has a system. It's called the CYP system. It's a cytochrome system. And I found, like that case I told you where I took the antibiotic and the liver enzymes went up, that shows that I have a very sensitive CYP system. So if I take a drug that somebody else takes and has no problems, I may have a lot of problems, and so the same is true for everybody. All of us genetically, that system is different in every single individual. And that's why I
Dr.
say,
Claire, I want to fit
those
something.
drugs at things,
Yeah, and it's so important. Casey, I wanted everybody that's on to know that Casey Pacheco will be our guest on August 9th. She is an RN. I'm fairly sure she's an RN, and very interested in healing the broken healthcare system on a community level and
Right.
making sure that the social determinants of health are met. And we'll have an amazing conversation with her. Amy, thank you for your activity. Nutritionist is important. And next week, Lynette Domingo, who represents something that you all know changed my life, which is a muscadine grape, a grape seed antioxidant, the strongest fruit superpower that we have on demonstrated clinically on earth.
Right.
She'll be with us to talk about nutrition, Amy, so don't miss next Tuesday night. I have a question that I ask everybody, and we're almost out of time, so I've got to ask you, Dr. Claire, fill in the blanks. I used to think that health was blank, but now I know that it is what?
Huh. I'll have to think about that for a minute.
I put people on the spot because it helps us.
Well, I don't know if I had a thought. I mean, I think health is everybody's personal responsibility. I think that we put too much stock into expecting doctors to fix things for us, which is not good, really. Like, my mother, was always the doctor, like the doctor walks on water. Well, they're not always right. So, I would say that my approach to health in many ways hasn't really changed that much. It's just that I made a personal decision to leave the field that I had been in to really focus more on, and I hate the word complementary. Okay. It's not a compliment.
It's an integration.
This is the original medicines. Okay. Are herbs. They are the original medicine.
Even aspirin is willow bark.
Yes. And, and do you know that the first aspirin was made in the late 1800s, but they didn't figure out until 1970 how it worked. Okay.
But sometimes that's not important as long as it helps.
Well, that's what I'm saying. It's like, okay, if you get a sore throat, my mother always said, go gargle with warm salt water.
Absolutely.
Okay. And then of course there's chicken noodle soup, which they did experiments on. They couldn't figure it out, but it definitely helps colds. Anyway, thank you.
No, I want to thank everyone for being here tonight. Every week, I am just so touched by how many more people are active and then communicate with me afterwards. So if you're not on Facebook, or I don't have a LinkedIn, I just have my own Tanya Abreu, but on Facebook, we have Rethink Your Health. We have an Instagram, and soon to have a blog that you can subscribe to. And everyone is going to be able to write on that blog. Like, I want to have like Amy Davenport, talk to me, give me a couple paragraphs of what you're doing in a small town to integrate best practices into your wellness. I would love for Dr. Claire to write there. We had, and I know I already have an article already from Dr. Rodriguez on pain management. It's really going to be an ongoing source. There'll be a headline that you'll get a text for or an email for. And if you want to read, you can click through. We only know what we know. And we have to be active consumers of what's out there, and we have to be careful with what's out there. There are people charging $5,000 to clear your chakras from 1,000 miles away, right? And then there are people charging $150 to have you come and, experience kind of energy self-healing. So really, let's just help each other. I want to tell you, thank you from the bottom of my heart. Thank you, Pam, if you're still online, for bringing Dr. Claire into our collective lives and into mine personally. And next week, next Tuesday, we'll have Lynette Domingo. She's an author and a speaker of a book called, I think it's The Power of Muscadine, but it's really about antioxidants. And antioxidants, as we are discovering, those of us that are nutrition crazy, are the protectors of cells. And we'll talk about how to get more of them in our lives and transform them. Thank you so much again. And I'll be in touch, Dr. Claire. And anybody that needs Dr. Claire, let me do this really quick. She can be reached and appointments can be booked at her Four Gates Oriental Medicine. The number is right now on your screen. Let me make sure it's on your screen. What the heck? There it is. Oh my goodness, there's just so many numbers. There's so many comments. Thank you. Thank you. But there's one question before I let you go.
Yeah.
Are there any top herbs that you recommend for daily toning, life necessity? That's a great question, Amy.
I usually, again, it's based on the tongue and pulse. And so, there's certain formulas like, there's one that is associated with longevity, but really, you shouldn't take anything constantly all the time. Like even with herbs, like you do 10 days, then you take a break. Okay. I do that with my supplements. I have a certain days of the week. This is a skip day. I'm not taking them today, because, I think your body can deal with it better that way.
Interesting. And it does make sense. It does make sense. Well, we are over time and I like to respect everyone's attention. Thank you so much. Okay, you may call if you're in South Florida, or if you're visiting, you can talk to Dr. Claire, 954-326-7310. She's on Facebook, Four Gates Oriental Medicine, and also has a website. Thanks again, everyone who's here. Next week is Lynette Domingo. Many, many blessings and health to you. Bye-bye.
Yeah, everybody take care of yourselves.
Good advice.
Okay. Good night.